iMed. Your eyes, your life, your choice.
It's only about 2.5 centimeters in diameter, but about 85% of our total sensory input begins from our sense of sight. So when it comes to eye care, you can't be too careful, and like any other organ, sometimes it could need a little repair. Here to shed some light on the latest eye surgeries in town is Dr. Ghajar with Eye Medical Center of Fresno. Doctor, welcome to the show. It's good to have you here.
Thank you very much.
It's
Thanks
good
for
to
having
meet
me.
you. Sure.
Nice to meet you.
You know, at the Eye Medical Center, you focus on corneal surgeries.
Correct.
Talk to us about the cornea for people that don't know.
The cornea is the window to the eye, so it's what allows us to see at the first step of the eye. Light needs to enter it, and it needs to stay transparent. And it's also the part of the eye that we use to reshape whenever we do LASIK surgery.
So it's obviously very important to take care of and to make sure that you keep it healthy, in other words, right?
Of course.
Okay, sometimes
yes.
we take our eyesight for granted, which is too bad.
That's true.
One of the latest techniques, DSAEK. Is that right?
Yes.
Did I say that correctly? What is that?
DSAEK is a sutureless cornea transplantation. So a lot of times people may have problems with their cornea and you need to transplant it. This is a new technique which allows us to do it without any sutures.
What kind of problems do you mean?
As far as that goes, usually this is limited to patients who have problems with the back of the cornea that allows, these are cells that make the cornea clear. And so if these cells are sick in a condition called Fuchs Dystrophy, or if they've had previous surgery which has damaged them, then you have to replace them.
How do we know that we're having problems with the cornea? Will we be seeing blurry, or what are some indications that we should go see you or see a doctor?
Typically, blurriness is the first sign, but you can also have eye discomfort, like you feel there's something inside the eye all the time. That's another condition.
Okay, so let's talk about what happens during the surgery. If in case you have problems with your cornea, it's a DSAEK surgery?
DSAEK, correct, or sutureless cornea transplant.
Yes.
I have a short video which I'd like to share with the audience, and this is a video that I prepared last year. We have, first what we do is we mark the cornea on the outside of it, and then we make an incision where we enter inside the eye. Again, this is the cornea, remember, is the clear window in front of the colored part. So we actually have to get inside. And once we get inside the eye, that's just a nice blade, and then we use an instrument to strip those sick cells. And this is, again, a transparent part. And so you may not be seeing anything, but under the fine microscope, we can see the edges of that sick endothelial membrane being stripped off, and that's what Descemet's membrane is. So we slowly and slowly strip that off, and then we bring that outside of the eye just to confirm that we have all of it removed in that marked area. So that's what's going on right now. In this image, you're seeing us still stripping that membrane off. It's very hard to see. Again, it's transparent.
So let me ask you this, because outside looking in, it looks incredibly painful, but obviously the patient is feeling nothing.
Of course. The eye's numb at this time. We've given a numbing shot around the eye, and that's that membrane that we just took off. You see it? You can actually see it now. And it's very thin. Now what we want to do is punch a donor cornea. This is a cornea from a person who has passed away and has decided to donate their cornea. We punch the same size, but we're only taking the back part of the cornea. So in traditional cornea surgery, we would take the full thickness, but this is only the back part of the cornea, and for that reason, we don't have to remove the patient's own cornea. There it is. That's the donor cornea.
This is amazing.
We just fold that over, and that's kind of a surgical spoon that we hold it with. We want to take very care not to damage those cells, and once those cells are they're kind of folded over on top of each other, we pick it up with an instrument, and we very gently insert it into the eye.
What's the recovery time like?
This corneal transplant, the DSAEK surgery, has a very fast recovery time compared to the old traditional corneal transplantation. Usually about 2 weeks compared to almost a year with the traditional technique.
That is
So it's
amazing what you
wonderful.
can do, and I know that there are other treatments in cornea surgery. Would you come back and share them with you, because we are unfortunately out of time. That was amazing.
Sure, of course, I'd
and
love
what you
to.
can do. If you'd like to reach the doctor, the number 486-5000, 486-5000, there it is. Or you can also visit the website at www.emcfresno.com. emcfresno.com. You can learn so much on cornea surgeries. Obviously, the latest technology is just amazing.
Well, thank you very much for having me. I was glad to share with the audience.
Well, come back and share more, would you?
I would love to.
Okay, thank you, doctor. It was nice meeting you.
Nice to meet you.
All right, don't go away, everyone. Central Valley Today. We'll be right back.
iMed. Your eyes, your life, your choice.